All right, we're looking at the impact of tobacco use on the symptoms of schizophrenia. I'm Katelyn Mulcahy, and my partner is Abigail Romine. We are a part of the Carroll College Nursing Department, and our question we were looking at was, in adults with schizophrenia, how does smoking cigarettes compared to not smoking cigarettes impact the symptoms of the disorder? So before we begin, we need to look at what exactly schizophrenia is, and it can be a very debilitating mental illness where their interpretation of reality is altered. So that might include hallucinations, voices, delusions, or very disorganized behavior. The three main symptoms are positive symptoms, negative symptoms, and cognitive symptoms. So we really focused on positive and negative symptoms in our research, and positive symptoms are psychotic behaviors such as delusions, movement disorders, hallucinations, and thought disorders. And negative symptoms are disruptions in normal emotions, reduced feelings of pleasure, diminished speaking, flat affect, difficulty beginning and sustaining activities, so like depression. So anyways, so we're looking at the health impact of cigarettes. So it's very widely known in the healthcare community that cigarettes have big consequences such as cancer, heart disease, COPD, and many others. And then we are looking at the self-medication hypothesis because we were not looking at better coping mechanisms than smoking. We were seeing if the self-medication hypothesis has standing. So the self-medication hypothesis implies that individuals use drugs for self-medication to reduce clinical symptoms and side effects of drug treatments.
And so this is kind of important. Why we why we wanted to do this topic mainly is because when we were doing our clinical rotations at the Center for Mental Health, we noticed that a large amount of people who had schizophrenia were going outside to smoke. And a lot of them said that it helped with the voices that they were hearing. So we thought, this would be a perfect topic to do our surf project on. So to get into the nit and gritty, I'm going to be talking about the first article, which is Clinical Implication of Smoking Among Patients with Schizophrenia at a Tertiary Institution of Southeast Nigeria. And so the aim of the study was to determine if cigarette smoking in schizophrenia is associated with an increased disability and psychopathology, which is basically symptoms. So this was a level 6 cross-sectional descriptive study. And what it did is they interviewed these patients with schizophrenia and gave them 3 questionnaires. They gave them the positive and negative syndrome scale, otherwise known as the PANS scale. And what this does is it assesses the severity of positive and negative symptoms of schizophrenia. And then they gave them a present state examination, which is a tool used to diagnose schizophrenia and smoking habits. And then they also gave them the World Health Organization Disability Assessment, which assesses the patient's level of disability from none to extreme on a numerical value of 1 through 5. So the answers of these questionnaires were entered in a multivariable regression model to find confounding variables that locate an association between cigarettes smoked and symptom improvement or declination. So the results were there was no significant difference in the mean PANS score of smokers and non-smokers. And then there was also no significant association between positive or negative symptoms and being a smoker or a non-smoker. The researchers also mentioned in the study that smoking is a meditative measure to evoke relaxation and decrease negative symptoms, which goes along kind of with our self-medication hypothesis. So the next article that we talked about was the effect of nicotine dependence on psychopathology in patients with schizophrenia. This was a level 4 cross-sectional study conducted in an outpatient psychiatric clinic at a general hospital in Malaise. And this study analyzed the prevalence of nicotine dependence and the effect of nicotine dependence on psychopathology among schizophrenia patients. So what they did is they gave them a mini international neuropsychiatric interview, which is an assessment tool used to interview and determine any psychiatric disorders. Then they gave them the positive and negative symptom scale, the PANSS scale again, which, as mentioned, is assesses the severity of positive and negative symptoms of schizophrenia. And then they gave them the Fagerstrom test for nicotine dependence. And this is a questionnaire tool to assess nicotine dependence. And then after the interview, subjects were performed a breath test to measure carbon monoxide levels out of the breath. And what this does basically just confirms that they do smoke and how much carbon monoxide they're expelling. The study found a significant association between nicotine dependence and negative symptoms of the disorder. And then the results also showed that nicotine dependence displayed a correlation with the amount of carbon monoxide that the patient expelled while breathing and the self-reported intake of nicotine.
So the next study was assessment of cigarette smoking status with respect to symptomatic manifestation in first episode schizophrenia patients. So this was a level 6 cross-sectional study, and it was looking at the relationship between nicotine consumption and systematic manifestation of first episode schizophrenia patients. So some of the medications that patients were receiving while doing the study was olanzapine, risperidone, amisulpride, Haldol, or benzodiazepines. And there was also 22 drug-naive subjects partaking in the study. To conduct the study, cigarette smoking was evaluated using the Fagerstrom test for nicotine dependence, and they used a pack year index. Research compared smokers and non-smokers using the Mann-Whitney U test, which considered age, illness duration, chlorpromazine equivalent, treatment duration, and PANSS factors. Overall, researchers found that cigarette smoking might be associated with the severity of negative and depressive symptoms, as well as delayed age of psychosis onset. Our last study that we looked at was the use of tobacco in schizophrenia, a double-edged sword. It was a level 4 cohort study. This study examined the association between schizophrenia and tobacco use. They enrolled 244 patients with schizophrenia and had 225 healthy controls. Researchers also collected a health history from participants, including gender, age of onset, age of first episode, duration of the illness, family history, and tobacco use. Researchers used the PANSS assessment tool and a brief psychiatric rating scale where they utilized to assess psychotic symptoms of patients with schizophrenia. According to the results, there was no significant difference between schizophrenia patients and healthy controls. Smokers presented with more severe psychotic symptoms at baseline and better improvement after medication than non-smokers, suggesting patients with worse symptoms tend to smoke to relieve symptoms. It should be noted that there were some limitations to all these studies. Some common factors that we noticed were that there were small sample sizes, psychiatric medications were being taken, studies were not done in a controlled environment, such as an inpatient care setting. Additionally, some of these studies were qualitative, which were self-reported.
So overall, the articles show conflicting evidence. Therefore, the research was inconclusive. The conflicting evidence was on whether or not smoking positively or negatively impacts negative symptoms of schizophrenia. One study suggested that the smoking may worsen positive symptoms, which kind of goes along with all the other ones. But several studies supported the self-medication hypothesis, which was big. And none of the studies had clear results on if symptoms were improved because of the smoking cigarettes or if it had something to do with the medications that they were taking. They were just all pretty different. So I think overall we could kind of conclude that it was inconclusive. So because of this, further research is needed, but nurses can use this research to conduct additional studies. As always, nurses can use this information to educate patients. I think we could say that for pretty much anything that we learn about, but mostly that the self-medication theory hasn't been proven effective or ineffective, and there are still significant health implications of smoking cigarettes. So that should always be stated to these patients or people who have schizophrenia that are smoking, that you kind of got to weigh the cost benefit of smoking if they believe that it helps them, or the possible repercussions of smoking and it causing COPD or lung cancer. Kind of take the good with the bad. Nurses can also use this research to be conscious of the symptoms of schizophrenia, may be positively impacted by the cigarette smoking. Like we talked about, most of the studies concluded that it helped, that there was improvement in negative symptoms, but not much on positive symptoms. So definitely further research is going to be needed to kind of assess the positive or the positive symptom wise. But overall, I think we really enjoyed doing research on this subject, especially since both of us really enjoyed our psych rotation. So we definitely would want to see further research in this study.
Yeah, I agree. I thought this was a really fun topic to research, and I think these studies lay a good ground or a good baseline to where further research could be made. So thank you for taking the time to listen to our presentation.
Yeah.